Hi, I'm Dr. Wendy Delaney, and I'm with Vickery Pediatrics. And today I have with me Dr. Kathryn, who's a psychologist with Focus Forward. And we have a couple of things that we wanted to talk about today. First one was how to identify when you and your child are moving beyond what's kind of normal childhood ups and downs, and maybe at a point where you could use some professional help at learning to manage their behavior and their emotions.
So first, I think it's important to discuss how to identify when your child is having the more than just the typical ups and downs. Kids these days, they get tantrums, you're in the grocery store, that sort of thing. Some of it's normal, some of it's not. And really the main thing is when it's interrupting your day-to-day life, then it's kind of important to seek help, because then you're not able to kind of go about your daily schedule and things get a little bit more interrupted.
Do you have any tips to help parents, like things that they should keep in mind when they're working on some of these behavioral challenges with their kids?
Sure. So I think the first thing that's really important is to keep everything concrete. So when you're teaching a new skill, make sure that you know exactly what you're teaching and teach it in a very concrete, visual manner. So that's the second thing, is have visuals. If you can have something on paper that you could show the child, that helps it get into their heads much better than if it was just kind of you having a conversation with them. The third thing I would say is repeated practice over time. So the first time you teach a child something, they're not going to remember it, but if you do it over and over again, then it's going to eventually kind of become more of their normal routine. And lastly, I would say it's very important to process emotional strategies afterwards and not necessarily in the moment. So if a child has a big meltdown and you're trying to talk to them, they most likely just need space and time to kind of process what's going on. And if you can talk to them afterwards and say, hey, I noticed that you got upset when this happened, let's talk about it, that tends to work a lot better.
Can you give me some example of some of the things that you were talking about that are really helpful when we're doing this?
I think the first and easiest thing to do is to get a child to learn how to breathe correctly and to breathe mindfully and in a calming manner. So a lot of kids, when you say, let's try to do some deep breathing, they go and they get really amped up and red and, they're not really calming down. But if you can have them do some belly breathing and really show them how that works, that tends to be better.
So you talked about using visuals. What kind of visuals do you usually encourage the parents to use when they're working on different techniques?
It's as easy as drawing a picture and drawing it out. So, for example, I tend to work with kids on small, medium, and large problems, or small, medium, and big problems. So I just draw out these circles so they can see. A small problem is something you can do on your own, can solve on your own. A medium problem would be something that you need an adult or a teacher to help you with. And a big problem is like an emergency. They can visualize it, and then when you're in the moment or after the moment, you say, hey, was that a small, medium, or big problem? And then we're much more able to answer that question. We regulate our own emotions without necessarily talking it out or recognizing that we're doing so. And our kids are always watching us. So it's important to kind of talk it out more. So I always tell parents, the more you can really verbalize what you're doing inside your body, the more the child is able to see what you're doing. Whether it's telling yourself something positive, like I got this, I can get through it, that sort of thing, or just telling your child that you're taking deep breaths or you're counting slowly to 10 or something like that.
This is really helpful, and I'm sure that my patients are really going to appreciate this, parents too. I appreciate you talking to me. Thank you.
Thank you.